Hello! Welcome! Good morning, good afternoon, good evening everyone. Welcome po sa 76th installment ng Stop COVID Deaths webinar series brought to you by the University of the Philippines. Thank you for being part of our credible online community. And to all those who have discovered us for the very first time today, welcome po at sana po masayan po kayo sa pag-join sa ating online community. As the economy slowly starts to reopen and workers po nanunumbalik na po sa kanilang mga jobs on a day-to-day basis, meron pong concern sa kanilang mga kaligtasan. Industries are claiming they are providing for sufficient health standards, testing, vaccination, kung saan man po applicable. The question still remains, are we doing enough to protect our workers? Ano po ba yung mga industries na maaari pong maging at risk as we are trying to open up more sectors sa ating pagbaba ng ating mga alert level systems? Ano po ba yung mga specific measures needed to provide optimum protection to our workforce? And if you want to get the answers po straight from the most credible experts, please stay tuned. Anyayahan nyo na rin po ang inyong mga kapamilya, kaibigan, colleagues sa katrabaho na mag-log in po dito po sa ating webinar for today. I'm Dr. Raymond Francis Sarmiento, Director of the National Telehealth Center, National Institutes of Health, University of the Philippines, Manila. Always a pleasure to be with all of you during our regular Friday lunch date. So medyo kakaiba po yung ginawa po natin last week na may game show format. Today, we are reverting to our standard na panel discussion. Really, I always look forward because I get to see the same familiar names and faces po dito po sa ating Zoom webinar. I'm sure ganun din po sa ating mga Facebook pages and sa YouTube din po. And so that lahat po sana ay mag-stay tuned para po sa ating webinar for today. At this point, I'd like to introduce my partner in crime, my mentor, also the Special Envoy of the President for Global Health Initiatives, our co-host po, also Adjunct Research Faculty at the National Telehealth Center, Dr. Susie Pineda Mercado.
Hi, good afternoon, Raymond. Magandang hapon po sa inyong lahat. Saan man kayo naroon, we're glad that you're here. It's a Friday afternoon and an opportunity for us all na matuto na naman. Alam mo, Raymond, sabihin natin, kahit na yung pinag-uusapan natin tungkol sa workers, hindi frontliners. Mga frontliners natin, meron mga family members na bumabalik na ngayon sa trabaho, no?
Oh, yes.
Siguro, gusto natin maintindihan nga anong ginagawa sa workplace, anong dapat gawin sa workplace para maging safe ang lahat, no? Kasi as we open up, 'di ba? There's always that concern na parang pag araw-araw ka nung lumalabas, mahahawa ka ba sa workplace, iuwi mo ba yung infection sa bahay, kung saan meron kang frontliner o senior citizen. So ito yung mga pag-uusapan natin. Ano ang gagawin ngayon sa ating workplace? We have a great panel of experts on occupational health, and we will also talk about the mental health dimension of COVID-19 and our workers. So, we've got something from TVUP. Raymond, go ahead.
Yes, thank you, Dr. Susie. Gaya po nung nasabi po natin, bumabalik po tayo sa ating regular format, which is the panel discussion. We always prepare something, a little short video para po to put our discussion into context. For this video, we ask the respondents po, anong programa ba dapat meron ang bawat workplace para po magkaroon po sila ng proteksyon, paprotektahan ang mga manggagawa mula sa COVID-19. So please watch this.
Para sa akin, ang dapat na program na ibinibigay dapat ng isang kumpanya sa kanilang mga empleyado, syempre, kahit every 2 weeks, meron silang RT-PCR o kaya yung saliva test, syempre, para din sa kanila yun.
Yung pinakamagandang program regarding that na naisip ko is actually yung work from home setup na binigay ng company sa amin.
Much better na kunyari 50% ng employees na mag-work from home.
Most people think it's for comfortability, pero hindi. Mostly it's for security na din ng mga employees.
You should have always alcohol sanitizers in the entrance.
To fill up muna the health form yung check lagi kung may naramdaman ka ba.
And if there is any COVID-related symptoms, they should report it immediately.
Bukod sa work from home setup, we also have swab programs and vaccination programs, and sobrang nakakatulong sa mga employees.
I let my workers to have RT-PCR when we are going out of town.
Every time you eat in our canteen, you should have wash your hands. Before we enter the hotel premises, we should always wash our hands and check for temperatures and
Social distancing until now, using face mask and face shield in work. But in my open place na site, they are using only face mask.
If we're gonna follow the regulations na binibigay nila, even if sometimes hindi natin maintindihan or hindi natin makita yung point or yung sense ng mga regulations na yun. Kesa naman yung hindi tayo makikinig, hindi tayo susunod, it can only make the situation even worse. Even if it doesn't make sense at times, I suggest na let's just all unite and syempre, let's just follow as much as we can.
Thank you very much, TVUP. It's always great to hear what people on the street are thinking about what's going on. Kasi nabibigyan din tayo ng perspektibo, no, para sa mga speakers natin, and also for you, kasi for our frontliners, syempre may mga tanong minsan ng mga mga pasyente natin or people who come to us for help. They're asking us questions and we should be able to give them really good advice. So we have some really good experts and resource persons today who will talk about safety in the workplace. And excited na kami kasi parang maraming pagbabago tayong nakikita at syempre gusto natin i-share yung information sa inyo. Raymond, over to you.
Thank you, Dr. Susie. Just a reminder lang po, no, kung pwede po kayong makapag-imbita pa po. We understand that we have nearly 1,500 registrants for this webinar. We are seeing that the registrants are slowly trickling in dito po sa Zoom. Obviously, there are those who are watching po sa YouTube and the Facebook pages of TVUP, the University of the Philippines Stop COVID Deaths. But we hope we'd be able to entice you and your colleagues to be able to join us dito po sa Zoom kasi po ang maximum po natin is 3,000 participants for this Zoom webinar. So please join us so you can fully experience the interactive program. And as mentioned po, maalala niyo po last week, gumamit po tayo ng special feature and function po ng Mentimeter. Medyo hindi na po ganoon ang ating format for today. We will be reverting to the 2-question format. And for those who are joining us for the very first time, ang gagawin nyo po, type in sa inyong internet browser www.menti.com and enter the code 3335-659. That's 3335-659 para po makapag-join po kayo sa ating poll. The same questions that are being shown sa Menti, that is also what is being shown dito po sa Zoom poll. So please let us know if you are having trouble in answering the poll questions. But we hope nandito po sa Zoom at yung sasali po sa Menti ay mag-join po talaga actively. And for those who are asking, may mga certificates pa rin po kami that we continue to hand out. But at least yung webinar number 75 na lang po ang natitira. For today, we have our director, Direct Gigi, who will be receiving the certificate. This is just an example po, but certificates will be issued to those who have attended at least 50% of the webinar duration. We are constantly sifting through all of the requests, especially to confirm if you really are eligible to receive the certificate. So please, we appreciate your patience po, and thank you so much for your continued support. Okay, Dr. Susie, I think let's just go ahead and introduce our opening remarks speaker. Everyone is really excited to learn more about occupational health and the preparations that's needed in order to protect worker safety. Please go ahead.
Okay. Sige, thank you very much, Raymond. Sige, so for today, our webinar is co-sponsored by the Philippine College of Occupational Medicine. So gusto natin batiin lahat yung mga occupational medicine specialists out there who are joining us today. welcome. You're welcome to the webinar, and we hope later on we'll have a good discussion. You can put questions later in the Q&A box. Sometimes people put in the chat box, or if you're watching from Facebook or YouTube, you can also put it in sa stream natin, sa live stream. Okay, so for our opening remarks, we have the Vice President of the Philippine College of Occupational Medicine. We'd like to welcome Dr. Ana Sofia Victoria Fajardo. Ria Fajardo. Welcome, Dr. Ria.
Thank you, Ma'am Susie. Thank you,
Sige,
and
go
good
ahead,
morning
give your,
po.
your welcome remarks. Yes.
All right, thank you so much. And good morning, greetings of good health and safety to everyone. Again, I'm Dr. Ana Sofia Victoria Tamayo Salazar Fajardo. In short, Dr. Ria, the National Vice President of the Philippine College of Occupational Medicine. And on behalf of our National President, Dr. Phil M. Pangilinan, and the National Officers and Board of Directors, we are truly grateful for this timely invitation from the University of the Philippines, UP Manila, National Institutes of Health, National Telehealth Center in cooperation with PGH to a special edition of the Stop COVID Deaths webinar series, of which I am very fond of attending. Ang dami na po akong certificate from this webinar series, and because of its relevance in our practice in occupational medicine. Thank you again, Dr. Susie Mercado and Dr. Raymond Sarmiento for this invitation. And we would like to acknowledge our esteemed speakers, of which some are very familiar to us as well. With the work also of PCOM, Dr. Joselito Gapas, Dr. Maria Regina Alampay, Dr. Rosalie Rivera, Dr. Paul Michael Hernandez, and Dr. Stella Marie Jose. The UP webinar series, Stop COVID Deaths, is also aligned with PCOM's vision to preserve, protect, promote, and enhance the health and safety of workers in all occupations while conserving the environment, thereby contributing to the progress of our nation. Now, I'd like to share a few messages from international organizations. And the International Commission on Occupational Health President, Dr. Juka Takala, released a statement early this year, around March of this year, which emphasized that safety and health at work is a fundamental right. So PCOM is here together with you and all the stakeholders of health and safety at work to ensure that all workers can have decent work, take care of themselves and their families, and contribute positively to the recovery of our national and global community. Now, Pope Francis expressed to the International Labor Organization there is an urgent need for economic reform and protection of all workers. And he went on to express a few key concerns. He said that it is a fundamental mission of the Church to appeal to everyone to work together to serve the common good, whose goal is above all to build and consolidate peace and trust among all. He added that the most vulnerable cannot be set aside in the dialogue that should also bring together governments, businesses, and workers. And as stewards of workers' health, we were faced with the daunting task of fighting the formidable COVID-19 virus in the workplace, but with the support and collaboration of different stakeholders, such as the medical community, the Philippine Medical Association, and the different organizations comprising the Health Professionals Alliance Against COVID-19, and our government agencies, the Department of Labor and Employment, Bureau of Working Conditions, and the Occupational Safety and Health Center, and the Department of Health. With these two important messages, it is evident that our role as occupational health physicians, as occupational medicine specialists, healthcare workers, it is vital to our mission to take care of the health and safety of all workers, to give dignity to their work. In the beginning of the pandemic, PCOM formed a COVID-19 technical working group composed of 12 hardworking members headed by Dr. Marilyn Evangeline M. Cruz to provide interim guidelines to our members on COVID-19 management in the workplace, return to work, workplace readiness, and mental health in the pandemic. The Philippine College of Occupational Medicine is also committed to increase capacity building through the training of health professionals taking care of workers' health through our basic course in occupational medicine, as well as our very first residency training program in occupational and environmental medicine at the University of Perpetual Health Medical Center here in Ninian, Laguna. We are also committed to work together with other OSH professionals, safety officers, OSH practitioners, to promote OSH advocacies in the workplace and become champions of workplace health and safety. We also collaborated with HPAC and DOH to come out with a workplace handbook to facilitate COVID-19 management and prevention in the workplace. We continue to collaborate with different stakeholders in order to address other workplace health hazards. So let us continue to transcend this pandemic. Let us continue to heal as one. Nandito po kami sa PCOM. Nandito po kami lahat para alagaan ang kalusugan at kaligtasan ng manggagawang Pilipino. Mabuhay po at stay safe po sa lahat.
Thank you very much. That's Dr. Ria Fajardo of the Philippine College of Occupational Medicine. Salamat, nako, such a timely message. At ngayon talagang nagiging kilala ang ating mga occupational medicine specialists kasi nakikita natin na, you know, we have to bring health to every setting, no? Hindi lang yung sa ospital, hindi lang gano'n, no? Sa lahat ng lugar, sa eskwelahan, lalo na sa lugar na pinagtatrabahuhan. So maraming salamat, Dr. Ria. We're looking forward to having you in the panel discussion later, maybe to answer some questions. And I'm going to turn over to Raymond. Raymond, go ahead.
Thank you, Dr. Susie. And thank you to one of our avid viewers, Dr. Ria Fajardo. We just checked. We have, I think, issued at least 10 certificates to her. So marami na po talaga na-attend na webinar si Dr. Fajardo for our Stop COVID Deaths webinar series. Thank you so much, ma'am. Okay. For today's webinar po, no, just so I don't forget to mention this, there might be a time when we might be asking a participant po from our audience po to open up their videos and their audios to ask the question to members of the panel. So we hope that those who are in Zoom, at least numbering a little over 860, will be able to, paunlakan po tayo na mag-ask po na kailang questions live sa ating mga expert group of panelists. But there will be questions po kasi that may be upvoted. So yun po yung mga katulong po kung ano po yung mga questions na pipiliin para po sa ating live Q&A session for later. So we encourage again everyone to type in your questions if you already have questions prepared dito po sa ating Zoom Q&A, maybe also in the comment section ng Facebook pages po natin at sa YouTube na rin po natin for the YouTube channel. Okay. May we have po again the infographic for Mentimeter para lang po alam po nila. May mga nagtatanong po paano po sila magla-login sa ating fun quiz. There we go. Okay. So for those who have just logged in, please type www.menti.com and use the code 3335659. That's 3335659, especially for those who are joining us outside of the Zoom webinar. We have two questions for today and these are as follows. May we have it on the screen po? There we go. Okay. Sa Zoom po, na-launch na po yung opinion poll po natin. We are just waiting on the... Okay. Thank you so much. First question. What should be done to prevent COVID-19 from entering the workplace? Para po mapigilan ang pagpasok po ng COVID-19, parang siya yung pumapasok sa sa trabaho po. Anyway, the options that we have right now: option A, education and awareness; option B, stakeholder engagement; option C, workplace screening, option D, work from home, and option E, all of the above. So we are seeing po 100 and almost 200 participants po who are responding to our fun poll. We are seeing I think very very similar numbers din naman po para po dito sa ating Mentimeter, 155 to date. So hopefully magkahiwalay po sila at very very unique so that hindi po ulit-ulit po yung mga sumagot po dito po sa ating fun poll ay different po dito po sa Mentimeter po natin. I'd also like to take this opportunity to greet those who are joining us all the way from the Occupational Health Nurses Association of the Philippines in Makati, Bicol University College of Medicine in Daraga, Albay, Cebu Institute of Technology University, Cebu City, Notre Dame of Marbel University, Coronadal, South Cotabato, and Iligan City Health Office in Lanao del Norte. For question number 2, what are the steps that should be done to prevent COVID-19 spread in the workplace? So, we have 6 options. Pili lang po kayo ng isa. Number 1, minimum public health standards. Number 2, ventilation controls. Number 3, routine screening. Number 4, early reporting. Option 5, contact tracing, isolation, and quarantine. Option 6, all of the above. Meron na po tayong almost 500 na po sa ating Zoom ang sumagot po sa ating opinion poll and 176 sa ating Menti. We will
Cute
not be
naman,
closing.
Raymond,
Ano
ang
po?
cute mo. Ako cute na ako dyan.
Yung
Hindi
gumagalaw
naman
po, no? Very nice. It's very, very nice.
Very cute.
Para siyang white blood cell, no? Dr. Susie, na lumalapit. So, ayun po. We will not be closing yet our opinion poll. Hopefully, more people will be able to join and provide the responses for this fun quiz. I'll just greet those who are joining us from Chonin Hospital in Taipei, Taiwan, Bangkok, Thailand, Penang, Malaysia, Kanto, Vietnam, from Dubai, United Arab Emirates, Taif, Saudi Arabia, Lunichi Ali University of Blida 2 in Algeria, and the University of Fiji in Lautoka. So maraming salamat po. Over to you, Dr. Susie.
Okay, thank you very much, Raymond. Tsaka babatiin ko din yung mga nanonood from the Department of Education. We always have folks from the Department of Education. Welcome to all our teachers who are regular attendees of the webinar. Okay, so we are going now to our main speaker. And our main speaker for today, nako, expert po ito. So sabi nga natin dito sa webinar, we do our best to give you the best speakers. And I've known our speaker for a long time. At meron kami mga pinagdadaanan na parehong mga issues related to the workplace. Siya ang tinatakbuhan ko pag meron akong question about ano bang gagawin pagka workplace ganun. Anyway, so we have he's an occupational health specialist and the head of Occupational Health of First Philippine Holdings Corporation. He is also adjunct faculty to the Department of Environmental and Occupational Health of the UP College of Public Health. So it is my honor to welcome Dr. Joselito Gapas. Lito, welcome to the webinar. How are you?
Thank you very much, Susie. Welcome everybody, and thank you very much for the graceful introduction. No?
Salamat. Go ahead.
Hindi kita pwedeng hindian pag ikaw ay nag-request sa akin. Alright, sige. So, magandang umaga, magandang hapon, at magandang gabi sa inyong lahat kung nasaan man kayo sa ating kapuluan, no? At saan man sa ating mundo. So, maraming salamat sa opportunity for me to talk about stopping COVID death and presenting to you what we call the approach or the concept of workplace bubble. And I will weave my discussion around the idea that addressing the COVID-19 from beginning to its eventual end is like a dance. Nag-iiba-iba po ang tugtog sa sayaw na ito. The more we know information about COVID-19, lalong lumilinaw ang tugtog. Pero ang tugtog nagbabago-bago. Ang outbreak tumataas, bumababa, may bagong variant, tumataas ang ating bakunahan. Kaya kailangan lahat ito nagbabago. Kaya moving forward, as we continue to protect our workers and our businesses, we actually need to continue to dance with the virus. Para po itong cha-cha. Hopefully, umuusad, konting backstep, pero uusad pa rin. Okay. So, I'm the head of Occupational Health of First Philippine Holdings Corporation. I'm an adjunct professor of the Department of Environmental and Occupational Health, College of Public Health, University of the Philippines. Ito po sa aking presentation, I declare no conflict of interest. Ano po ang ating pag-uusapan ngayong araw na ito? Pag-uusapan po natin, unang-una, yung tinatawag naming conceptual framework. Paano ba namin tinitingnan ang COVID-19 sa workplace? How do we prevent and protect workplaces and ensuring business continuity during COVID outbreak? Importante po na titingnan din natin yung business continuity sa ating mga kumpanya. Kasi importante yun sa atin. This is also the reason for why we are in the workplace. So, although our priority is protect the health and safety of our people and their families, we have to protect also our businesses. I'm going to share with you kung paano namin ininterpret visually itong conceptual framework para lalong maintindihan ng ating mga managers, ng ating mga workers, at ng kanilang mga pamilya. Pangalawa, pag-uusapan po natin ang isang case study. Maikli lang po ito about how First Philippine Holdings Corporation or FPH, ano ang ginawa nilang strategy, including yung aming vaccination program na ang tawag namin ay Vac to Normal. Lastly, magtatapos po tayo sa isang diskusyon on ano ba ang hinaharap natin. What are the future scenarios of the COVID-19 outbreak? Importante na meron tayong prediction or projection kung ano ang mangyayari sa COVID outbreak sa dadating pang mga taon. Dahil pag may projection tayo, pwede natin itong paghandaan. So, how did we expect the COVID outbreak to be? And how did it eventually turn out? Nung nag-umpisa po ang COVID outbreak, kami sa industry, at least ako personally, medyo naive and innocent pa ako. At the start of the outbreak, we thought that it would be a simple inverted bell curve yan. Tataas, bababa, we will hammer it with draconian control measures. And it will simply settle down and remain low. Occasionally, it will come out, sporadic but easily controllable spikes. Ito na yung tinatawag nating, magsasayaw na lang kami sa virus dito. Konting kembot lang yan, mawawala na yan. This is our naive thinking when we started the COVID outbreak in 2020. Unfortunately, and in retrospect, the outbreak turned out very differently. Instead of the simple bell-shaped curve, ang daming multiple peaks and surges, even in the Philippines. This is driven by lumalabas ang iba-ibang infectious variants like the alpha, beta, gamma, delta. Sayaw tayo ng sayaw sa mga variants na yan. There is also insufficient and inadequate public health measures at the start globally, not only in the Philippines. There is no country in the world that is actually prepared for this pandemic. So we learn as we move along. Sabi ko nga sa team ko, para tayong barko na tayo ay naglalayag na pero ginagawa pa rin natin ang barko. So pwedeng may konting pasok ng tubig, but address natin yan. We hope to make it better in the coming years. Pangatlo is the delay in our vaccine acquisition and vaccine inequity, especially in low and middle income countries. So at this time, we are definitely not back to normal. So what is the COVID-19 risk management strategic framework? Ito yung tinitingnan namin na konsepto ng bubbles. The strategy that we developed, we said, dapat hindi sabog ang ating strategy. Dapat may maganda tayong choreography. Ano ba ang 4 key aspects of control and protection that we should focus on. So we have identified 4. The workplace, importante yan, because we have workers and business partners that we need to keep safe. And it's also our reason for being private sector. We have to protect the workplace. Pero nilawakan pa namin ang aming perspective and said, hindi lang sa workplace, pati sa bahay. Dahil ang workers natin umuwi sa bahay. Pwedeng, pag hindi natin poprotektahan ang ating tahanan, pwedeng magdala, ma-infect ang ating workers at pumasok sa workplace. Worst is, pwede mag-uwi ang ating mga workers sa kanilang tahanan at ma-infect ang kanilang mga kasama sa bahay. So the home is another focus. We also said, hindi naman forever ang ating workers at ang ating household members ay nasa workplace at sa bahay. Lalabas at lalabas yan. Dahil dadating ang pagkakataon na bababa ang outbreak, tataas ang bakunahan, mag-o-open up ang ating society and business. So dapat tinitingnan din natin how our people, workers and their household members could be helped so that there is a semblance of protective bubble while they're moving about in the community. Lastly, we have said ang ating workers ay magbabiyahe from home to work. We need also to protect them while traveling in between. Therefore, we have identified these 4 key focus of control and protection, and then we illustrated how the things that we will do as bubbles. Protective, preventive, and reactive control bubbles were implemented to reduce the risk from COVID-19. So anong ibig sabihin sa amin ng safety bubble? A safety bubble is a set of engineering, administrative, personal protective equipment, and other measures designed to reduce the risk of exposure of people to the COVID-19 virus and to minimize and prevent spread. We also realize hindi perpekto ang ating bubbles. Tatagusan at tatagusan tayo. Therefore, anong ilalagay natin na recovery measures so that kung meron man may infection sa loob ng bubble na ito, we can do something to identify them fast and to help them recover and go back to their normal lives. Okay. So for each bubble, this is our more detailed concept of and strategy. Number 1, we need to prevent seeding. Seeding means control measures that we need to put in place to prevent the COVID-19 virus from entering the bubble. Second, we have to have a strategy to prevent spread, which is to prevent COVID-19 virus from infecting people if they are already inside the bubble. Tatagusan na tatagusan kami, and we know that. We need also to put in place and ask, paano tayo magre-recover? Dahil we need to have measures to ensure that infected persons recover from infection and return to normal function. So, our bubble, may 3 kaming atake. How do we prevent seeding the bubble? Second, how do we prevent spread if it gets in our bubble? And finally, how do we recover so that we can save lives and go back to our business as fast as possible? So, what's light about our company? The First Philippine Holding Corporation is a holding company with interests in clean and renewable energy. We are involved in premium real estate, manufacturing, construction, healthcare, and education. First Philippine Holdings businesses all work to ensure a decarbonized and regenerative future. Okay. So, in a nutshell, what are we doing within the company? Please take note that from where I operate at the corporate level. And my team at the corporate level has a responsibility to guide our various businesses. we are not naive as well because we realize ang aming iba't ibang kumpanya, iba't iba ang business process, iba't iba ang kanilang kakayahan, iba't iba ang kanilang lokasyon sa Pilipinas, okay, at iba't iba ang kanilang ugali or level of education ng aming mga workers and their household members. So, ang una naming sinabi is, there is no such thing as one size fits all. Hindi pwede na dikahon ng ating management. So when we started early in 2020 to develop our fit for purpose programs, we required all our companies to conduct first a site risk assessment before they develop their company-specific COVID-19 risk management program. We have to know your individual risks so that we can develop a program that is appropriate for that risk. Effective but not wasteful. To protect people but not to unduly burden their health or their mental well-being. So we have to think first and think fast. All our companies were required to consider as well the ongoing outbreak in their location. Ano ba ang operations na ginagawa ninyo? Iba't iba po ang control measure kung ikaw ay nasa opisina, ikaw ay nasa isang construction site, ikaw ay nasa isang power plant, or ikaw ay nag-ooperate ng isang mall. Iba't iba ang risk profile ng mga yan. Iba't iba ang mga stakeholders. We also ask them, ano ba ang available resources natin? Because we cannot put something that we cannot afford to implement and sustain effectively over a certain period of time. Mag-inventaryo tayo. Anong kakayahan natin? And lastly, and very important, tingnan natin ang worker and family profiles natin. Kailangan natin maintindihan ang ating mga kasama sa trabaho at kanilang pamilya. So we put all of this together and each and every company now develop their what we call fit for purpose and cost-efficient COVID-19 protocol. So overall, speaking generically, our program has several components. Yung unang-unang component are control measures that protect the workplace. Please bear in mind, hindi lahat ito ini-implement ng lahat ng aming kumpanya at exactly the same way. It has to be thought well so that fit for purpose sa kanilang pangangailangan. I will focus my talk more on the yellow highlighted elements here. I'd like to spend more time on the work from home concept. Kasi although logically napakadaling gawin na akala natin, okay, many of us before COVID has even been dreaming of sana pwede ako magtrabaho sa bahay. And then suddenly here we are right now. And yung experience namin dito, it is not as easy to work from home. And not all of us have the proper work environment, nor the proper IT tools to do their job from home. It is very difficult, for example, to have a housewife juggling her work while maintaining the house and cooking and taking care of the household. Sabay-sabay na po yan. So, isa yun sa learnings namin sa work from home. Because of that, we have opened up some of our work sites medyo outside of the city center na tinatawag nating protected work locations. Kung ikaw ay masyado ng pressured sa bahay, once in a while, you can transfer to this work site, pwede ka magkape, pwede ka magtrabaho, naka-online ka, to distress. At least once in a while, you can escape the pressure of working from home. But definitely, working from home has been a very effective tool in minimizing the risk of infection to our workers. And marami na rin nagsasabi, we do have return to work screening, questionnaires, temperature check. In fact, ang questionnaire namin ngayon online, so wala ng paper form, madaling recover. We always adhere to the use of face mask, face shield, hand hygiene, and physical distancing. Pero to be honest, hindi kadali ito kung ang trabaho na ginagawa mo is underground. So kailangan mo talagang aralin kung ano yung nature of work ng inyong mga workers para ma-implement mo ito properly. We have early detection of cases and contact tracing. We have testing. We do have quarantine and isolation protocols for COVID positive workers and their families. We have treatment and work integration programs. Around the middle of the outbreak, we began focusing on ventilation system. Okay. So, importante ang ventilation. Pero ang mantra dito, if you can work outdoors, that is best for you. If you can work without air conditioning and your windows and doors are open in workplaces, that is very good for you. We also have in place a safe link protocol. Because of our testing in our workplaces, we have on-site RT-PCR testing booths. One of the recent innovation that most of our companies are now implementing is the advanced social distancing tracking system. Ito po yon ang litar. Para siyang ID, sinusuot siya ng lahat ng workers pagpasok sa trabaho, naka-identify yun sa kanyang sarili. Pag ang isang worker lumalapit ng more than 2 meters sa isa, nag-a-alarm po yan to remind them of physical distancing. Hindi lang po yun, rinirecord niya electronically sa database yung mga interaction ng isang worker sa lahat ng ibang workers na nakakasalubong niya. So that, pag meron kaming suspected case in the workplace at sa tingin namin COVID positive siya, in 5 minutes, meron na po kaming close contact tracing list because of this advanced social distancing. Another control measure that we put in place is yung tinatawag namin shelter in place. Ito po yung ginawa namin sa mga aspeto ng negosyo namin na very critical to operations and to workers. For example, in our power plants, very critical po yun sa amin at hindi lang sa amin pero sa ating bansa. We cannot afford our power plants to shut down. And we cannot supply electricity to the country. Napaka-importante po yun. Because of that, in locations where we have power plants, nag-adapt po kami ng tinatawag naming shelter-in-place work arrangement. This is a diagrammatic example dito ng shelter-in-place. Pag pumasok po ang worker dyan, para kang nakahiwalay sa tunay na mundo. There is a bubble here that covers your accommodation facilities and the workplace na nakabubble siya. Bago pumasok ang aming workers dyan, meron kaming tinatawag na pre-shelter-in-place protocol. May cleaning period po kami. Magkwa-quarantine sila for 10 days. May RT-PCR testing on day 5 or day 1 and then another RT-PCR testing before they enter the bubble. Kasi napaka-critical ng aming operations at kailangan ng bansa. So we need to protect them and put the whole workforce na kailangang pumasok at mag-operate ng isang proseso sa isang bubble. They stay there for long periods of time, sometimes 2 months, bago mag-rotation. But we needed to put in place also measures to manage their emotional and mental health and well-being. So yung po'y tinatawag namin shelter in place. Pero hindi po lahat ng aming workers ay naka-shelter in place. A vast majority of our workers are working from home. Ang mga iba is occasionally pumapasok sa trabaho, while others are now regularly reporting for work. For those workers namin na hindi shelter in place, we do routine antigen screening every 1 to 2 weeks for our non-shelter in place workers, especially during the time of surges, para ma-identify kagad namin kung sino ang positibo. Para kang naggugupit ng damo sa inyong hardin, ginugupit mo siya regularly para hindi tumaas ang damo, pero hindi nawawala yung damo, pero hindi siya dumadami. So this is a measure that we put in place to prevent spread in the workplace and also to prevent entry into the workplace. Our third component is protect the home. Sabi ko nga kanina, napaka-importante nung home-ended household member. Pag may sakit ang isang miyembro sa bahay, hindi nakakapasok o abala ang worker and may impact yun sa trabaho and vice versa. So we have put in place since the very start ang tinatawag naming Family Protection Guide. This is basically an information and awareness campaign. Ang tinutuunan nito ay to make the household competent and have the capacity to protect themselves. To protect themselves from the outbreak outside of the home, what to do if there's a suspected person, COVID case in the home, paano kung may nag-home quarantine na tao doon, at ano ang gagawin kung lumalala ang symptom niya. All of this is contained in our family protection program. Our third component is we need to provide support services. Okay. We are staying apart. We are losing our social contact with our coworkers and our other friends and support groups. But we need to maintain that communication. So all throughout, very important, yung aming COVID hotline manned by our health team. It is a 24/7 service to our workers and business partners and their families. We have teleconsultation kasi hindi naman po lahat ng sakit ay COVID o lahat ng tanong ay COVID. So, meron din silang matatawagan na they can talk to a doctor, get consultation, get medical advice, get prescriptions online, or get referral to specialists and hospitals as needed. We have to do this remotely. Lastly, we've realized this from the very start. Emotional well-being and mental health will become an issue in COVID. Okay. Especially in our case, workers who are working from home. So we have a project. It's called Reach Out. Okay. It is an emotional well-being and mental health assistance program. People can call, can Viber, can Google, and they can be made in touch with a counselor. Kung kailangan, meron tayong face-to-face. Our fourth component is communication and engagement. We've realized napaka-importante nito sa isang programa. Kailangan maintindihan ng mga workers kung bakit. Ano ang nangyayari sa paligid nila? Anong nangyayari sa COVID-19? Ano ang ginagawa ng kumpanya? At ano ang dapat nilang gawin kung sila'y pupunta sa trabaho? Kailan sila magpapabakuna? So, this is very important because we believe na people are rational beings. If we inform them properly, they will decide rationally and support the program. Our last component is vaccination. Let's vaccinate our employees, contractors, business partners, and household members. Lastly, in terms of our recovery measure, na-realize namin na pag dumating ang surge, meron kaming employees and their household members na mahihirapan humanap ng quarantine facility kasi puno na lahat. So what we did is we have put in place the Lopez Group Isolation Facility for employees. Ang tawag namin po dito ay Life Center. Okay. We have the San Tomas Suite is a small hotel that we are under our group. We have repurposed it to become a COVID-19 isolation facility for our group and the Lopez affiliates and their families. The facility is operated jointly with our group and Ayala Qualimed Hospital. The facility accepts RT-PCR confirmed asymptomatic or mild low-risk COVID cases. For moderate to severe cases, these are admitted at Qualimed hospitals in Tanawan, Batangas, and in Santa Rosa, Laguna. A little information on our vaccination program. It's called Vac to Normal. Pinalad po kami, lalo na sa Pilipinas, that the private sector companies in the Philippines were allowed access to vaccines via tripartite agreement with government and the vaccine suppliers. So when we thought about this, and I think when we were given the opportunity very early on, November pa lang of 2020, or October, we were already planning. At that time, wala pang mga bakunang lumalabas. All of our vaccines are in the research stage. So we need to have bets. We need to decide in advance. Mag-a-acquire ba tayo nito? Baka pumalpak, baka hindi siya successful. Pero wala kaming choice. We have to make bets. And in the process, we developed these several steps, which now has become our journey. We developed a good organization within our company and a plan to implement it across our enterprise. We have identified, at that time, we were monitoring the scientific literature, ano ba ang safe and efficacious vaccines? When we identify them and were given the opportunity, we acquired these vaccines. In fact, we were able to acquire for our use AstraZeneca and Moderna. Part of our journey is to communicate and engage our stakeholders to foster awareness and create demand. Okay. So ang target namin po dyan are our employees, our contractors, and their household members. We engage third-party partners. We are around 13 to 15 operating companies with 30 to 40 sites all over the Philippines. We definitely couldn't do this vaccination alone. So we partnered with Reliance United and AC Health as our vaccine administrators and Zwillig Pharma as our logistics provider to bring the vaccines from the warehouse to the vaccination sites. We moved on to sino ba ang babakunahan natin? Paano ba natin sila ima-master list? Paano ba natin silang i-register? And then we prepare the vaccination sites. Right now, we are in the tail end of our adult vaccination process. Malapit na po kaming matapos, mga 1-2 linggo na lang, tapos na yung adult vaccination namin. But at the same time, we are gradually moving to monitoring and pharmacovigilance kasama ng aming vaccine administrators. Remember earlier on, we said we made bets. And in our case, sometimes we have excess vaccines. And on these occasions na meron kaming excess, nagpapaalam kami sa Department of Health for us to reallocate our vaccines to our LGUs as partnerships with our host community. Kasi hindi naman po pwedeng kami lang ang bakunado at sometimes yung aming mga host communities ay hindi nababakunahan. The COVID virus does not need an ID to enter our worksite. So we need to protect our host communities as well. This is not to give you an information on where we are right now sa amin pong bakunahan as of October 26. As of October 26, 95.9% of all our employees have been vaccinated with the first dose at least. Amongst those, 77.4% are fully vaccinated, 18.5% have received their first dose. By the end of October, which is very near, all second doses would have been delivered. Naghihintay na lang po kami ng tamang interval period para mabakunahan ang aming partially vaccinated. At malapit na po kami umabot doon. All throughout this time, we have experienced minimal vaccine hesitancy because of our intensive education and demand generation campaign. Nasaan po kami ngayon? Ready na rin po kami and waiting. Pag pumayag na at binigyan na po kaming go-ahead ng ating gobyerno, ng ating Department of Health, we are ready to vaccinate our adolescents, 12 to 17 years old, in our household members, and we are also almost ready to vaccinate booster doses pag pumayag na po ang ating Department of Health at meron na tayong implementing guidelines on how to do so. My third part is we would like to share with you yung scenarios. Ano yung nakikita namin in the future, at least for the next 2 years? Ano mangyayari sa COVID? In retrospect, which I stated earlier on, ang sinasabi natin is, at this point, pababa ang outbreak. Pero hindi ibig sabihin na hindi ito pwedeng tumaas ulit. Na hindi tayo pwedeng magkaroon ng fourth surge or even fifth or sixth. So how do we project this moving forward? Although COVID-19 vaccines are being rolled out right now, the crisis is not close to being resolved. But simply, we are moving to a new phase. Ano-ano ang magdedetermine ng bagong phase na ito? Number 1, evolution of COVID-19 virus. Meron pa bang padating na future variants na mas malupit at mas mabilis kumalat? We have to keep our guards and our eyes on that. Second, ano ang magiging behavior ng ating public moving forward in the next 2 years? Okay. There is a general relaxation trend right now of public health measure compliance. There is more mobility. Our economy is opening up again. And andun pa rin yung vaccine hesitancy. So tinitingnan natin, ano ang talon ng publiko at ano ang sayaw because it will also determine the new phase of COVID-19 outbreak. Third, ano ang magiging response ng ating pamahalaan sa mga darating na taon? Would it be better? Would it be less better as we are right now? Do we have or will we have a better national and LGU coordination? Better partnership with public and private sector? Ano ang gagalaw ng ating gobyerno? Importante po ito kasi sa 2022 is an election year for us. It can be a potential to determine the new phase of COVID-19 outbreak in our country. Pang-apat, minumonitor natin kasi it will determine the new phase yung dumarating na mga bakuna. Andito na ba yung silver bullet na ating hinahanap? Will we have a vaccine that will be 100% preventive of COVID-19 across all variants? Meron na ba tayo o magkakaroon tayong silver bullet? Ano ang mga paparating na mga treatment modalities na very effective for COVID? It will also affect the new phase like molnupiravir, papadating na po yan. Lastly, tinitingnan natin ano ang galaw ng mundo or internationally. Will there be good international and national coordination? Or will many of our countries remain nationalistic? Or magigising na ba tayo na it is a global approach? Because nobody is safe until everybody is safe. If we forget to help a few countries, for example in Africa, incubator lang yan po for new variants that will spread in the future all over the world again. So itong limang ito ang nakikita namin na determinants of our new phase of COVID-19 outbreak. At this point, we see now as a naive assumption that we will ever achieve herd immunity dahil hindi pa nga natin alam saan ba talaga nanggaling ang COVID virus. Until we determine the animal reservoir, pwede yan pumasok ulit later in the future. Incomplete pa rin ang ating vaccine coverage. And then, yung vaccines natin hindi pa perfect. Although they are very good right now in protecting us from serious COVID, hindi pa rin siya perfecto. Kaya nakikita natin, kahit na bakunahan na, meron pa rin tayong breakthrough infections. So, anong future scenario natin na at least us in this industry foresee? We see two extreme scenarios. One is what we call the most optimistic or one world scenario. This is when a new generation of vaccines are effective against all and present future variants. Meron tayo niyan, hopefully. And then the outbreak control is pursued in every country and accompanied by global coordinated effort. That is the most optimistic scenario. And even then, baka kailangan ng mga 2 pang taon bago mahinto ang COVID. On the extreme end naman, there is an extreme pessimistic scenario, or some of the experts are termed divided world scenario. In this very sad scenario, COVID-19 variants repeatedly emerge with high capacity to escape vaccine immunity. That only high-income countries are able to respond, manufacturing adaptive vaccine for multiple rounds of immunization, while the rest of the world struggle with variants and with insufficient and less effective vaccines. So sabi namin, there must be a pragmatic scenario in between. So what is potentially a pragmatic scenario in between is that the endemic COVID-19 can happen. Endemic, it will be with us for a long period of time, just like the flu, that there might be sporadic outbreaks and localized surges until effective vaccines are developed. So, as my last slide, ito po ang aming corporate direction moving forward in the next 2 years. We will plan our existing operations and new projects based on the intermediate scenario na sinabi ko kanina, endemic scenario. We will review our existing protocols and control measures and adjust for longer implementation, at least 2 years. We have to dance with the virus. We have to modify and adjust our protocols and control measure as the outbreak waxes and wanes and as more and more of our society get vaccinated. Definitely, a return to the new normal by end of 2021 is unlikely. We will plan and resource all our operations in new projects for an endemic COVID-19 sporadic outbreaks and occasionally localized surges until effective vaccines become available. We will need to protect our business partners as well. Hindi pwedeng kami lang. We have to work with our contractors. We have to work with our supply chain companies so that sama-sama kami at kabit-kabit na ang aming mga workers o manggagawa ay napoprotektahan sa COVID. We will look at vaccines and vaccination protocols. Napaka-importante po ito moving forward. We will ensure that we will have the capacity to rapidly acquire new generation of COVID-19 vaccines. And we will maintain our system so that we can have rapid mobilization and deployment of said vaccines amongst our target group and our people. Definitely, we will need to strengthen our health organization across our groups. The past 2 years is like in the middle of a hurricane, in the eye of the hurricane for us in the health team. We have to make ourselves more competent and perhaps add 1 or 2 more people to help us navigate our enterprise through this COVID-19 outbreak. Lastly, and most importantly, we need to go back to our stakeholders, our workers, our family members, our household members. We need to engage them and communicate. We have to set them up information-wise and internal thinking-wise that we are headed for the longer term, a bit more, because we might head into an endemic COVID-19 scenario. So we need to prepare our people for that. Para ready din sila at ready din silang makipagtulungan sa amin para we can protect the workplace. Okay. So the dance with the COVID-19 virus continues. And thank you very much for your kind attention.
Okay, thank you very much. That's Dr. Lito Gapas, the head of Occupational Health of First Philippine Holdings. Ang galing nga, no? Grabe. This is probably, Lito, this is the best public health perspective lecture I have ever heard. So, and I think our audience, our audience realizes that we really have to be thinking about it holistically and also thinking about what might happen, good or bad, what might happen, so that we can prepare. Napakalinaw, no? Tingnan mo yung audience natin, gusto nila.
Very impressive. Thank you so much, Dr. Lito.
You'll
be able to note it in the chat, Dr. Lito, na for the forward thinking steps that you have laid out.
Tingnan mo, Lito, yung mga comments. Kasi, our audience, they have listened to many talks, no? But you'll see how much they appreciate your thoughtfulness and your thoroughness. Tsaka very calm si Lito, parang ganito, ganyan. Galing! Hey! Okay, sige. So, Lito, we have an open forum later, and I'm sure, there will be some questions. For those who have questions, please put them in the Q&A box. We move to another aspect of bubbles and workplace safety. So, we will now talk about mental health concerns of our workers. And I remember our speaker because when we were in WHO, we were doing some studies on mental health in the workplace. And so it is my pleasure to introduce Dr. Regina H. Alampay, who works as professor at the Department of Psychology at Ateneo de Manila University. And she is working with the Ateneo Center for Organizational Research and Development, and they have just finished some studies on mental health and workers. So Gina, welcome to the webinar.
Hello, good morning, everyone. And thank you for the invitation. Hi, Doc Susie, long time no see. And I'm very happy to see all of you. And I'd like to thank Dr. Gapas. That was a wonderful presentation. So my take naman is on the ensuring the mental health of our workers. So what I'd like to do today is share with you what the studies are so far on the impact of COVID on mental health. And then how do we build mental health and resilience in general, and then specifically, what can organizations do to support their workers? So from May 2020, we began gathering data. And what struck us in the past year was that when we took a look at, so we looked at three things, no? We took a look at the level of stress, the level of anxiety, and the level of depression. And if you take a look at the chart here, the darkest red are those that are extremely stressed, extremely anxious, or extremely depressed. And if you can take a look at this chart, you'll see that among those three mental health outcomes, anxiety, okay, and depression were the ones that were really worrisome. No? Ang stress, medyo pa siya, parang normal curve pa siya. But anxiety really, really heightened because of the pandemic. And if you ask me who are the most at risk, we identified two particular groups. One are the youth. So the mental health outcomes for both stress, anxiety, and depression were highest among the younger people. So 25 years old and below. And there are biological reasons for this. So our physical bodies mature quicker than our brains, and our brain matures mid-20s, right? So our ability to deal with stress isn't as well developed until we hit our mid-20s. But the second group that had poorer outcomes were women compared to men. And partly, this might be biological as well, because mas taas talaga ang mental health illness among women. At the same time, it might also be, there might be a social component to it, because especially in a work from home setting, the pressures of not just balancing work and family are there, but now with online schooling, you also have now the additional burden of becoming teachers, right, to your children. So for those of you out there who are doing this, you know what we mean. So these are the two groups that are most vulnerable. Plus, we're seeing that among these mental health outcomes, it's anxiety that is the issue. Now, when we ask people what stresses them the most, so obviously we have the expected exposure to COVID, the illness, the issues of governance, so the lack of access to basic needs, the loss of income, especially we've seen so many, an increase in unemployment, right? We've also seen, because of the new work from home or because of the diminished workforce, people are increased responsibilities to the workload seems greater. Those of us, as Dr. Gapas was saying, before we would think of work from home as, ay, ang sarap. Pero now, parang ang hirap, di ba? Kasi we seem to be working even more nonstop without breaks, unlike before. But there are social issues also that are stressful. So one, the physical isolation, as said by our first speaker, is an important stressor, especially in a collectivist culture like the Philippines, where part of our coping, part of our well-being is the well-being of those around us and the ability to reach out. In our study, we also found that discord in the family. So syempre, lalo na kung close quarters, no, hindi naman kayo sanay na 24/7 in each other's faces. So meron ganyan. And in fact, people who have been coming to us were saying, anong gagawin ko sa bugnutin na asawa or sa, masusungit na anak, kasi nga stress lahat with the confinement in the work, in the home. But another source of stress is COVID-related information. And for those of you who you might have experienced this, minsan, di ba, parang nakaka-depress magbukas ng Facebook, ang daming namamatay. Or sa Viber group, panay condolences ang naririnig natin. So that itself is stressful as well. ano lang, just a spot check para ano. Tingin ninyo, alin dito ang pinaka predictive of stress? Alin kaya dito ang pinakamalaking source of stress? Pwede ko bang gawin yan? Pwede ko naman gawin yan, di ba? Pwede nyo bang i-chat? Ano yung tingin ninyong source of stress dito? Which of these? Oh, daming loss of income. Loss of income, governance.
Yeah, go ahead, Gina. Okay yan. Gusto niyo lang mag-comment.
Sige. sige.
Go ahead.
Yan, increased responsibility. Social support. Okay, illness. Okay. Discord in the family. All right. Puro income, ano? Baka magulat kayo sa results. But our results show that when we ran a regression analysis on this, it was actually the lack of social support that was the strongest predictor. Na sabi ko nga, ako rin, I would expect loss of income. Maybe because not everyone who responded to the survey actually did lose their income. But everyone experienced the loss of social support. And that's very telling, no? So for this particular learning session, which is the work bubble, what an interesting finding was exposure to COVID because of work actually was negatively correlated to stress. So ibig sabihin, the more exposure you had, the less your stress. So parang kami, bakit ganon? But if you think about it, it's because when you go to work, you also have social support, right? And so there seems to be a buffering, this work bubbles, as we're talking about, there seems to be a buffering role of being able to interact with your office mates, being able to see them. And I had a group of about, my work team is about 35 people. And especially since I have marami akong bata na staff, parang sobrang sabik sila whenever we have to meet because of work. Because hinahanap nila yon, yung personal touch, yung kwentuhan na nawawala in the day-to-day interactions online. Okay? So, anong pwede nating gawin? One of the things that we found was that what buffers having these stressors, because these stressors are beyond our control, right? And they do predict these mental health outcomes. But what buffers the relationship of COVID stressors and these outcomes is resilience. So resilience, the personal resilience of being able to cope with the stressors that I am experiencing. Moreover, what we found was that coping behaviors, how people are coping with their situation, does matter. So if you ask, so is resilience something innate or can it be developed? It's actually both. To be honest, there are some people, because of personality, they are more resilient. There's a personality, there's parang a set of personality traits that make people more resilient. For example, people who are more emotionally stable are not as reactive to others. People who are perhaps a little bit more less neurotic. So meron personality traits. People who are hardy are more resilient. But the good news is resilience can be developed. It's developable. It's something that you can nurture. And the other point that I really wanted to make was that oftentimes kasi we look at resilient as, something that's individual. We often heard about during disasters, post-disasters, no? The Filipino is resilient. But the truth is, it's not just the person. Resilience, the way we look at resilience today is from an ecological perspective. Yet, yes, there's a personality character, there are abilities that are individual, but resilience is also a function of your family, how your family is reacting, right? So for example, last month, my entire family got COVID. So what's funny was I was the last one. So initially I was negative, and all the rest of my 4 kids and my husband and kasambahay were all positive. So I had to make sure that we were not just physically okay, but we were also mentally okay. So if it meant that I had to be the strong one because people were all feeling sick, right? So that's the role of parents in making sure that their kids are okay. So even if it means checking up with them every once in a while, are you okay? How are you feeling? Are you down? Do you want to talk? That's very important as well. And of course, for this particular learning session, the role of organizations, that as we had a great presentation on how employers can take care of their employees to make sure that they're okay. And then, of course, the role of government in our communities. We've seen how in this pandemic, some LGUs have stepped up and done well, some LGUs not so great, but that really does matter. So what can organizations do to help employees become more resilient? In the mental health and psychosocial pyramid, we actually don't start with mental health. We start with ensuring the basic needs of employees. So whether that means making sure that they have access to vaccine, or making sure that when an employee is sick, they get the basic needs that they have. So for example, in our case, because we were all quarantined and isolated, nobody could really go out. It was so important, parang ang laking tulong na parang there were some groups sending us food, sending us meds, or even as mundane as toilet paper, kasi sobrang importante yon. So these little basic needs, they can help making sure that people get the help that they need. And then, of course, the importance of self-care. Most people will not need, mental health specialists, but many people will be able to help themselves. And I will elaborate on that a little bit, on what are some ways that we can help our employees take care of themselves. Our speaker, Dr. Gapas, also talked about employee care, and he did a great job about talking about what employers like, what they're doing. He talked about wellness programs and benefits. I'm a firm believer that we should actually allow mental health breaks or mental health leaves as a part of sick leave. Kami, we're very, di ba, some companies, pag nag-sick leave ka, kailangan may certificate ka pa. Ako naniniwala ako na pwede ka mag-sick leave kasi burnt out ka or napapagod ka na lang talaga. That should be counted because physical and mental health, they are very much intertwined. Part of employee care might be making sure that there are people in the company who can do what we call psychological first aid, which means that when there are employees who are distressed, your HR, usually it's the HR people, no? Or sometimes your medical people, or in some companies, they've actually trained their supervisors to do psych first aid. So you know what to do, right? So a lot of people may not be necessarily comfortable dealing with employees in distress, but there are some basic things that we can help them do. So psychological first aid, I believe, is something very integral. I also want to emphasize the importance of making sure that employees who do get sick are not stigmatized or discriminated, because we're hearing a lot about that as well. Na parang nagkasakit ka na nga, sinisisi ka pa o parang takot pa sila sa'yo. Parang it doubles the burden of getting well when you also put that another layer or stigma and discrimination. So protocols to make sure that that does not happen. And then, of course, for those who might be more than mildly distressed, you may want to consider resilience programs. Not sure if Dr. Gapas knows, but our team had been working with the Lopez Group in implementing a program called Katatagan. We did that first for those who were let go maybe a CBN. But this program, it's a resilience program that consists of 6 modules, develops adaptive coping skills, from managing your body reactions to managing your negative thoughts and emotions to being able to look at your routines and being able to look at basic things like sleep and nutrition, etc. And then, of course, access to providers, counselors, therapists, hotlines that they can call, doing debriefing when something happens, when there's a death, for example, or there accidents in the workplace, or there's a spread, just being able to address those, and even considering peer support groups. For example, yung mga namatayan, or even those who are survivors of COVID. I hear that for some, especially yung medyo severe, there's a long COVID, they talk about long COVID that are actually making people anxious na bakit okay na ako, pero bakit parang malabo yung ano ko, parang memory ko, or parang sometimes my brain gets foggy. So all of these are not contributing to the lowering of mental health and increase in anxiety of people. And then, of course, for those who are extremely distressed, it's important that the companies or organizations do have referrals to mental health professionals. And some companies now actually have include this as a benefit, under their insurance package or under their employee care package. People can have access to mental health professionals. So I want to go back to what we can do, The problem kasi with mental health professionals is there's not enough of us. The ratio of psychologists to Filipinos is about 1:100,000. The ratio of psychiatrists to Filipinos is even worse. So it's about 1:200,000. So there are just not enough mental health professionals. So what we are advocating actually is let's prevent the escalation to mental illness by focusing on prevention of illness, by focusing on strengthening coping, how people cope. This was one of our findings from our study, that certain coping behaviors appear to be more helpful than others. So for example, the first two, the ability to problem solve, the ability to look at your situation from a positive perspective, or from simply to reframe it and to view it in another way. That is actually negatively related to depression, anxiety, and stress. So for example, last year when we began online schooling, a lot of students were really getting depressed, anxious, and stressed because they feel, I'm not learning anything. I don't like this online learning. We had a lot of student dropouts. And part of helping them is helping them look at the situation and say, yes, online learning, maybe it's not as great as learning face-to-face. But would you rather not be learning at all? So sometimes it's really how we look at the situation. Are we a glass empty, or half empty, or half full kind of person, and really helping people reframe how they're viewing the situation. Same thing with work from home setup. We can say this really sucks, but there's depends on what we focus on, the negative part of the work from home or the positive part of the work from home. We are also seeing that spiritual support was actually negatively related to depression and anxiety. So one of the things that I normally do encourage families and parents is your rituals before, like going to mass, continue to do that. So even if it's online, because we do need to continue using the things that are comforting to us. These three coping strategies interestingly, no, distraction, which a lot of us use, right? We just watch Netflix, or but it's actually what we are seeing is that the greater distraction was actually related to depression, anxiety, and stress. Of course, this is not a causal study, but it can be that the distraction is not letting us attend to what we're going through. So this is related to denial. So for example, not accepting that I'm stressed or I'm depressed or anxious can actually be counterintuitive or counterproductive, because you're not addressing or you're not admitting that you're not okay. And I know it sounds cliche-ish, but that's one of the messages that we psychologists have kept pounding to people. It's okay not to be okay during this time because it's an abnormal situation. And so just admitting that you're not okay, sometimes that's important. We're also seeing an increase in substance use, whether that's alcohol or smoking. And that's actually counterproductive, because we're seeing that, again, like distraction, what it might be doing is it just makes us forget for a time, but it's really not addressing our problem. So what does this mean? Huh? It means that not all coping strategies are functional or are helpful. And as what organizations can do is we can help our employees develop the more functional ways of coping that are more important during this time. At this point, I'd like to share with you a tool for self-care. And I know one of the problems in companies is we don't necessarily have programs in place or even mental health professionals or people who know how to help our employees. This is a project of the Department of Health, Mental Health, and the USAID Renew Health Project. So the mobile app, which was actually just went live this week, is called Lusog Isip, or Mental Health. And we pilot tested this mobile app last month in September among 206 users. And most of them, actually half, were employees in the workplace. Okay, and they came from the entire Philippines, from Luzon to Mindanao. And what did we find? So what we did is we randomly assigned people to either the mobile app or a workbook that is being used by DOH in its isolation centers. And the good news is that both tools actually did improve well-being after 2 weeks of use, and both the workbook and the mobile app increase the ability, what we call cognitive reappraisal, the ability to see things differently or from a more positive light. But the one advantage of the app, which was we did not see in the workbook, is the ability, it's what you call emotional release. And it's the ability to say, I'm not okay, or the ability to admit that I'm feeling sad today, or I'm not okay, and reflecting on why I'm not okay. And I'd like to share with you some of the comments of our app users in terms of what they learned after the 2-week use of the app. So one theme was how important it is to take care of our mental health. So as one said, mental health is as important as physical health. And another theme is how important self-care is. As one user said, we can actually do something about what we're going through, even in the pandemic. But in order to be okay, we first need to be self-aware, and that's the first step. One of the things that one user said, I learned about my well-being and coping mechanisms, which is important in being more self-aware. And another theme was there are healthy ways to cope. So one comment was people cope in different ways. We just have to find the ones that are healthy and useful. Another theme was the importance of expressing our moods and emotions. So as one said, taking a few minutes a day to keep one's emotions in check helps assess which aspect might be causing us to be anxious. And I like especially this, even if it's an individual app, there were comments about feeling not alone, that they felt that, I guess that they're not the only one having problems, so it's okay, right? And so one person said, the most valuable learning about mental health and substance use I have are the idea is that I'm not suffering alone, and the adverse effect of smoking, alcohol, drinking, and substance use. So if it's okay, I'd just like to share a little bit this video.
No audio, Dr. Gina.
Oh, sorry. Okay, sorry. There's no audio. Let me see how to do this. Sorry, let me go to the original file para hindi. I think that might be the issue here. Sorry about that.
Feeling stressed? That we feel overwhelmed, anxious, or unwell. But there are healthy ways to cope. Introducing Lusog Isip, the first mobile app for self-help on mental health and wellness, culturally adapted for Filipinos. It uses evidence-based tools and interventions to help you help yourself so that you can improve your overall well-being by reminding you daily to look after yourself. Now, you know where to find help when you need it the most. Download the Lusog Isip app now.
There. So I guess I'd like to end with that, and the hope that if you think this might be useful, go download it and spread the word that this is available and it's free. Thank you. Thank you all.
Thank you so much, Dr. Gina Alampay. Really excellent presentation po, no? Sharing with us the latest in research on mental health of the workers po. Ma'am Gina, please join us later on sa Q&A session as we move on to our two reactors later on. Thank you po. Next, we'll have two reactors po, really excellent also in the field of occupational health. First, we will have the country health manager of Shell companies in the Philippines, Dr. Rosalie Rose Rivera. Dr. Rose?
Good afternoon, Doc Raymond, and thank you for having me.
Thank you so much. Ma'am, go ahead with your reaction po.
Oh yeah, sure. So thank you so much, and I really enjoyed the two presentations from Dr. Gapas, who is a very dear friend and my previous boss actually. So Doc G, ang galing talaga, and Doc Gina. Kung hindi matanggihan ni Doc G si Doc Susie, ako naman hindi ko matatanggihan si Doc Gapas. So a very, very impactful reflection. So what I can share from our experience in Shell companies in the Philippines, yung dancing with the virus, that is really very, very real. And I just like to add in our experience where we have to operate so many various types of situations for our workers. We have the Malampaya that we have to operate, which is very remote. It takes us about 7 hours of helicopter to be able to bring a patient to land just to get into a hospital. And that supply is very crucial the energy of the Philippines, we actually provide natural gas to First Philippine Holdings as well in their energy plants. And then we also have our own plants all over the country. We have about 22 nationwide, so many islands as you would imagine. No? And also we have contractor vessels that ship our fuels, our road transport, yung aming mga lorry drivers. We also have field staff, no, yung aming mga sales staff who goes to very essential operations during the pandemic, mga pharmaceutical companies, the food industry, in addition to energy companies, for example, have to continue even during the pandemic. So our field staff were very much exposed during the pandemic. The other thing is, of course, we have a BPO, which is 4,000 plus employees, so including ourselves na corporate, no, so we had that arrangement ng work from home, as what Doc Gapas also mentioned earlier. So ang daming dancers, no, dito sa Dance with the Virus na sinabi ni Doc G kanina. So it's really yung sinasabi ni Doc Lito na risk-based and fit for purpose, no? You cannot have a single solution for everything na maiintindihan ng workers. Where communication strategy was very, very important for us kasi it was really confusing, no? If we are confused, definitely the workers who need to comply with all of these health protocols are also confused, even if they wanted to comply. Kung nakakalito yung information na binibigay natin sa kanila, they really wouldn't know how to do it, no? Ang dami mong kailangan gawin. Mag-physical distancing ka, magugas ka ng kamay, mag-mask ka, etc., etc. All at the same time, on top of what they are already doing. It's really very daunting to the workers, no? So simplification of communication is very key in our strategy. And I cannot stress this enough. Yesterday, I was in a lecture with a postgraduate course, also with UP. At ito yung isa sa mga key factors that we really discussed in terms of having our occupational health programs. The other thing I'd like to mention also is yung nabanggit ni Dr. Susie kanina, no? Yung when sometimes you feel na if you're going to work, exposed ka doon and you might transmit it to your family, no? And it could be a source of stress also, no? Just like what Doc Gina mentioned. In our experience, syempre not the field staff kasi they really go to the retail stations and to the community. Pero in our plants and in our offices, yung mga pumapasok pa rin, they actually felt safer in our operations because we were really also able to put in place very similar to what Doc G has mentioned, so that when they go home, more than 50% ng aming COVID cases ay na-expose actually sa bahay, and then about 45% sa community, and then 5% yung na-expose when they go to the health facilities, no? So we never really had a transmission in the workplace because we really made sure that our workplaces were really safe. So medyo nagkaroon ng reverse in terms of exposure, no? Tsaka yung risk of transmission. The other thing I'd also like to react on is on the support, no? On the support that we had to supplement the existing support that we already have in our company. For example, of course, we have HMOs and we have health partners as well. No, we practically have very similar health partners with the First Philippine Holdings. It was really a challenge for the healthcare industry to quickly respond to the pandemic, where digitalization was very key because there were no more face-to-face. So we really have to work hand in hand. No, it's very daunting to everyone. Kaya yung tulungan, it was really very key. No, we cannot be pinpointing fingers because things are not working. Just really go straight ahead and come up with solutions to really help everyone. So the healthcare industry has been really stretched, and I think digitalization is still a journey for us, especially in the Philippines, but it's very, very key so that we can really dance with this virus and all. Not to mention yung contact tracing, which First Philippine Holdings did very well, and also yung telemedicine and all other things that could make our lives easier. So digitalization is one of the things that we are really looking into right now. Now, in addition to the support, we had to add more leaves, no, to our staff, so that for those who need to care for their families, they have leaves. As you know, COVID could take a long time, no, to recover. So taking care of the family, in addition to being sick yourself, you really need a lot of time for that. In addition to all these other things, I think one of the key things that also had a very big impact to us is on our support to mental health. We have an existing mental health program already, and thanks to the presentation of Doc Gina. But one thing that we had to quickly respond to are, of course, the services. So yung aming counselors, they also had to go through telemedicine. And you know how Filipinos are, face-to-face tayo, no, culturally. So that took a while until more people became more comfortable with the online consultation. We had to increase the services. Last year, we increased it by 30%, and then this year, we increased the services to 20%. Talagang ang daming nangangailangan ng counseling sessions with all this, the ones that Doc Gina shared are being experienced. So right now, we have about 25 sessions a week, extending up to late at night because of our BPO. We were fortunate to get some Filipino counselors abroad in the US, so we can manage the time zone para accessible kahit sa gabi yung ating counseling services, because our counselors really are also overworked, no, with our employees. We had to add grief counseling. No, I realized that there is such a specialty of grief counseling, Doc Gina, where they really specialize on traumatic events like a sudden loss of a loved one. And even our employees, they just get shocked that someone passed away amongst their colleagues, no? It was really affecting the productivity. So we came up with the grief counseling, individuals, for families, and for team members in our organization. So the other thing I'd like to add there is yung dancing with the virus. No, we recognize that we will be having fluctuations. No, sabi nga ni Doc G kanina, yung dancing with the virus. The nice thing in occupational health is we're really strong in terms of anticipation, no, and predicting with so many scenarios. Siyempre nakita ni Doc G, that's really our core, one of our core work in our company, where how we see it in our future of work, we call it future of work in Shell, is that ang dami kong binigay na scenario sa inyo, no, yung mga workers namin, where those that will be working from home will actually be given the choice whether they still want to continue working from home or they would want to go to the office. And we just have to have a system around that and agree with the managers. But they will be given that voluntarily, so that in our healthcare industry, in our healthcare services, I'm discussing this already with our healthcare provider, we need a hybrid model. We cannot do away with telemedicine, but we need already face-to-face as well, because people are already starting to go back to the office once, you know, we get a very good vaccination rate. And hopefully, I'm the optimist. I have this optimistic scenario, of course, preparing also for a worst-case scenario. But for the healthcare industry, we would be needing that kind of a hybrid digitalized system, where one of the key things to manage physical distancing also is we want an appointment system already in our consultations. If you know Pinoys, right? We do walk-ins with our doctors, and long lines in the corridors of the clinics. We cannot have that anymore. So we're coming up with our centralized appointment system together with our healthcare provider in a hybrid model, whether it's telemedicine or whether it's face-to-face, and then really planning very well if you really need a face-to-face consultation with your doctors. Of course, that's a limited service kung telemedicine, as we would all know, no? Kailangan pa rin talaga ng face-to-face in certain instances, but this will be really have to be planned. And then facing the endemic, hopefully, no, the endemic scenario where COVID will be treated like a flu, yeah, just like anything else. So we would be needing to enhance the other services that we have to be able to really empower people to know what to do if they have symptoms. Alam niyo yung culture kasi ng Pinoy, kahit may nararamdaman na, papasok pa rin tayo, right? So one of the things we are really advocating is that if you're not feeling well, do not go to the office, do not go to the plant, and then you can find a way with your manager to continue working from home. Yung iba kasi sobrang sipag talaga, they really want to go to the office. Ano? So ito yung mga challenges in terms of behavior that we see in our employees. And lastly, just to share with you, with a very similar program like the First Philippine Holdings and the tips and the suggestions, recommendations of Doc Gina, in our company since this pandemic, we had actually, I consider a successful COVID-19 program because we have very little cases. It's just about 10% of our employees were confirmed to be positive. And we had very sad and unfortunate deaths of about 9 staff out of 4,800. So that's about 1%. And we honor these deaths by making sure that we learn from the challenges that they have experienced and making sure that other employees will not experience the same, just to make sure people are more ready and prepared when COVID hits home. And also, of course, yung healthcare system where there's really coordination and organized coordination and early planning should anyone feel the need to go to a hospital or a clinic. People got really scared of going to the clinic and hospitals. We don't blame them, but there are ways on how they can feel safe in resuming their normal lives because we have about 18% with the comorbidities and marami sa kanila felt that napabayaan na nila yung kanilang diabetes, yung hypertension, and all the other non-COVID diseases, but of course can pose them to become have a more severe COVID case in case they get COVID. So marami silang napabayaan na mga health concerns. So we're also planning for that so they feel safe when they resume their normal lives. So yun lang yung akin, I can react to the 2 presentations, Doc Raymond, Doc Susie. Thank you. Audio, Doc Raymond.
Thank you po. Thank you so much, Dr. Rose Rivera. Malaman pa rin po yung yung inyong reaction. We really appreciate it and you will also note it in the chat box, Dr. Rose. Thank you so much po. Thank you. So after hearing from Dr. Rose Rivera what the shell companies in the Philippines have been doing to ensure the safety of its employees, we will now have our final speaker for today. He's an occupational health expert po, and he is also the chair of the Department of Environmental and Occupational Health at the College of Public Health in University of Philippines, Manila. Please welcome to the webinar Dr. Paul Michael Hernandez. Dr. PM?
Thank you, Doc Raymond. And again, thank you for inviting me as one of the reactors for this event. I'm a bit pressured because all of the speakers are my seniors, except for Dr. Alampay, in terms of health and safety. So I'd like to highlight that existing principles of occupational health and safety, particularly industrial hygiene, change management, and health promotion and education can also be applied to COVID-19. Dr. Gapas mentioned or highlighted the 4 safety bubbles, particularly instituting evaluation activities and controls both within and in between bubbles. Dr. Gapas also highlighted stakeholder engagement and even anticipated the scenarios in terms of this pandemic. On the other hand, Dr. Alampay discussed about mental health. Particularly, she focused on lack of social support, which I would like to say has already been considered for job stress, for understanding job stress, particularly the Karasek's job strain model, which highlights that workers get stressed if they have too much job demands, if they cannot decide on their own or limited ability to decide on their own, plus the absence or presence of social support as shared by Dr. Alampay. Dr. Alampay also mentioned about the bioecological model for workplace, which can be applied for workplaces. We have the employee as at the center, and then the social sphere, which includes work, family, friends, and community, the political sphere, and ultimately the cultural sphere. So I'd like to highlight a few points. The first one is on the hierarchy of controls. In terms of us controlling SARS-CoV-2 in workplaces. SARS-CoV-2 is although an evolving agent, is another occupational hazard in which workplace exposure can be controlled. We need to determine what is the acceptable risk, and we need to institute the control measures. It was mentioned earlier, we have engineering controls, admin controls, and PPEUs. Dr. Gapas and Dr. Rivera mentioned about these control measures as applicable to their workplaces. But how about those with limited resources? How about smaller companies and enterprises? We are not, yes, there would be limited resources, but this challenge can enable us to be creative in coming up with control measures. I'd also like to point out, while we're controlling SARS-CoV-2 in workplaces and in the individual bubbles, coming up with controls trying to reduce exposure to this virus may introduce new hazards. So it was mentioned earlier about the work from home setup and how we can observe or maximize work hygiene. I understand there are workers who get tired when working at home. They cannot maximize their work time. They have to go somewhere else. They miss their office space, so that these concerns are actually anticipated based on existing occupational health principles. Second point would be on stakeholder management. Occupational health and safety activities, programs, and services require engaging stakeholders. We need to engage regulatory agencies. So for this particular case, for the workplace, that will be the Department of Labor and Employment. For the private sector, we have the Department of Health for the public health workers in the informal sector, and then the Civil Service Commission for the government sector. Aside from regulatory agencies, we need to engage management, very important of course, employees, partners, and even community members, the surrounding community of that workplace and the communities where the workers stay or are part of. We need to ask them what they think, what they need, and what they can offer throughout all the processes of planning, implementing, monitoring, and evaluating OHS programs, strategies, and activities. Instituting controls, for example, the hand hygiene, wearing face masks and face shields, vaccination, requires a change in behavior. We need to understand the whys, particularly why is there a resistance? For example, for vaccination, why don't they want to go on site for work, etc. Furthermore, we need to have a clear and shared vision with the management, employees, community, and partners, so that we can easily get stakeholder buy-in to ensure success of all OHS programs. I'd like to conclude with reviewing the aims of occupational health. Occupational health aims to, number one, promote and maintain the highest degree of physical, mental, and social well-being. Number two, prevent diseases and injuries. Number three, protect workers in their employment of risks or hazards. At this point, that will be SARS-CoV-2. And lastly, placing and maintenance of the worker in an environment adapted to his or her physiological and psychological capabilities. To reiterate, existing principles of OHS, particularly industrial hygiene, change management, and health promotion and education, can also be applied to COVID-19. Thank you very much and have a great day.
Thank you very much. That's Dr. PM Hernandez from the UP College of Public Health. Okay, naku, we're at the top of the hour na, Raymond. Paano ba to? Sige, mag-ano muna tayo. Public
Well,
service.
let's do the public service announcement po. Yes po.
Okay.
Birthday, mahal!
Thank you, mahal!
Happy birthday, Mommy! Hi, Dad! Hi, Mom!
Happy birthday!
Thank you, mga anak! Thank you!
Love you, Mommy!
Miss na namin kayo.
I miss you, both of you. I miss you.
Miss ko na kayong lahat.
Mommy, sana magkakasama na tayo muli.
Miss na namin, Mommy. Happy birthday, Mommy.
Miss and love you, Mommy.
What did you wish for, Lola?
My wish? Magpapabakuna na ako.
Ako din.
Dahil mahal ko kayo, magpapabakuna ako.
Thank you so much, TVUP. The COVID Communication Public Service Announcement is one of the many outputs of the UP research entitled Communicating COVID-19 in Post-Quarantine Philippines. It's headed by the UP Vice President for Public Affairs, Dr. Elena Pernia, and funded by the DO-SDPCHRD and the DOH under the HSPR project. Dr. Susie?
Yeah, thank you very much. Raymond, let's go to the answers to our questions at the fun quiz.
Okay, can we have them? There we go. Thank you, Monica. We have two questions po ulit, no? Number one, what should be done to prevent COVID-19 from entering the workplace? I think we got this question from Dr. Lito Gapas. Dr. Lito, can you help us answer this? Maybe it's just a reiteration of what you mentioned already, sir.
Okay, salamat Raymond. No? Talagang ang pag-atake natin sa mga risk ng COVID-19, hindi pwedeng iisa lang. Maraming aspeto ito at yung mga nakasulat dyan ay kailangan nating lahat. Kasi figuratively speaking, parang the diamond can only shine pag marami siyang facets at tugma-tugma yung kanyang facets. So we have to have all this control. It has to be holistic and it should be appropriate to the situation.
Thank you, Dr. Lito. And then for our second question, what are the steps that should be done to prevent COVID-19 from spreading in the workplace?
Yeah. So, ganun din na, Raymond, lahat ng ito dapat andon sa ating control measures. Education and awareness, napaka-importante niyan para maintindihan nila bakit. Stakeholder engagement, to empower them to change their behavior. We need also to do workplace screening. And lastly, yung work from home is a very effective way to reduce exposure. So, lahat po yan ay pwede nating ilagay sa control measures natin.
Ayan. Thank you so much, Dr. Gapas. Dr. Susie?
Okay. So unfortunately, Raymond, we won't have time to take any more questions. So I just encourage our panelists to pick out some questions in the Q&A box and answer them directly. Meanwhile, we're going to launch our evaluation, and that will give our speakers a minute or so to construct your parting words for our audience. So Raymond, let's go to our evaluation.
Thank you so much to the more than 1,000 attendees who are still in the Zoom. Ito lang po ang ating evaluation poll. There are no evaluation links or otherwise. This is a 5-question poll with Likert scale po para po sa mga options po. We are seeing that respondents are still tuning in, and we hope that more and more of our attendees who are still numbering, I guess as I mentioned, more than 1,000, pumasok po dito. Medyo maaga po ang pagkaka-click. Okay, there we go. Can we ask you to answer it again? Kasi may nag-click po yata ulit ng end ng poll. Anyway, the questions are as follows. The panelists demonstrated thorough knowledge of the topic. The panelists were well prepared and organized. The panelists spoke clearly and audibly. The panelists used appropriate language with technical medical jargons adequately explained. And finally, the panelists contributed to new perspectives and knowledge on managing various key COVID-19 health issues. Thank you so much as we move on to the final messages po of our speakers. Dr. Susie?
Okay, thank you very much. We'll have our first parting message from Dr. Hernandez. So PM, please go ahead.
Okay, thank you, Dr. Mercado. So, of course, this virus, this pandemic will take us quite some time to respond and to recover, and we need everyone to be on board. We need the management, we need the employees, and we need other stakeholders who can help us in addressing this pandemic. So we need to have a shared vision so that we can ensure the success of our respective COVID-19 prevention and control programs. Thank you very much.
Thank you very much. Let's go to Dr. Rhodes.
Yes, Doc Susie, what I can add here is that just like to stress yung approach na risk-based and evidence-based in all of the control measures that we do. We need to be really studying the science behind it so that tayo kasi yung pakikinggan ng na we are seen as experts, so we need to be making sure that these are really at the forefront and simplified so that people will not be confused. Therefore, they will be easier to comply with whatever these control measures are. Thank you, Doc Susie.
Okay, thank you very much, Rose. Let's go to Gina.
So our advocacy has always been, when we talk about health, let's not just talk about physical health, but let's give importance to mental health as well. So I know wala pa tayo sa insurance natin yan, and there's really a lack of laws in terms of how much should be invested in mental health. But let's be proactive for organizations. Let's make sure that we only not take care of just the physical health of our employees, but as well as their mental health. Thank you.
Thank you very much, Gina. Lito, Dr. Gapas.
Yeah, I'd like to share ano yung palagi kong sinasabi sa aming mga senior leaders. That number one, good health is good business. And take note, una ang good health for good business. Prerequisite yan. Pangalawa, that anything we do for the health and welfare of our workers is just as important as any other business process we do in our companies. Pare-pareho yon. And lastly, to everybody, nobody is safe until everyone is safe. So let us all come together and as a one country and one society, move together to make sure that we address the COVID outbreak today and in the coming years.
Thank you very much. That's Dr. Lito Gapas. Let's go to Dr. Ria.
Thank you, Ma'am Susan. So as stewards of health, again, I'd like to repeat, everyone here can be stewards of health. Let us work together, collaborate, communicate, and cooperate to be champions of workplace health and safety, because there is an urgent need, not just because of this pandemic, but in the future generations and years to come, for economic reform, for good governance, for the protection of all workers, and to ensure that all workers will be able to have, again, decent work, to be able to take care of themselves, to be able to take care of their families, and be able to contribute positively to the recovery of our nation. Thank you po.
Thank you very much. Okay, so for our closing remarks, we have a summary from our Deputy Director of the Philippine General Hospital, Dr. Stella Marie Legaspi Jose. Stella, welcome.
Thank you for this opportunity to give the closing remarks. I would like to commend all the speakers for their excellent delivery of their lectures. From Dr. Gapas, he emphasized the continuing dance with the virus. So I agree with him totally. I think this pandemic will not end soon. We'll have to give it more time because the virus is undergoing mutation. He emphasized the key aspects of control of this pandemic: the workplace, the home, the community, and traveling to and from our work. I also commend his narration on the First Philippine Holdings Corporation. He said the first component is protect the workplace. That is also what we are doing here in PGH. We are protecting our workers. We have RT-PCR regularly, and anyone can be quarantined if the patient, if he or she, the worker, is symptomatic. But I would like to commend his advanced social distancing, where they have IDs that will record the close contact and the tracing of that person and who he or she has met. You know, this is the first time I've heard of that kind of social distancing tracing. And he said we should protect the home. That's very true. We see here in PGH, if one member of the family gets sick with COVID, sooner or later the whole family will get sick. We have to provide support services for our employees. And I commend their company for doing that. So they also have their hotline, their teleconsultation, and the emotional well-being of their employees. So here in PGH, we are instituting that also. So we have the mental wellness program that is under our office. And also now we have the burnout policy. So gradually we are seeing the light of this pandemic in terms of our healthcare workers. We have to have good communication and engagement with our stakeholders. And very important is the vaccination of all our healthcare workers. Right now, we already have quite a high vaccination rate of about 92% as recently announced in our infographics. From Dr. Gina Alampay, I also appreciate her lecture on mental health outcomes, who are most at risk. And she said 25 years and below are at risk, and those with poorer outcomes are more in women than in men. And the COVID-related stressors are for our health. They are afraid of the exposure to the COVID virus. The healthcare workers are afraid of getting sick themselves. Governance, or access to basic needs, and the loss of income. And for occupational aspects, the increased responsibilities are continue to stress our workers. And for the social part, the lack of social support, discord in the family, and social health issues. We coming from Dr. Rosalie Rivera from the Shell company. She explained the situation in their company, the many factors that are contributory to their healthcare workers' mental issues. And she mentioned the simplification of communication. So as not to confuse our workers, we have to simplify our messages so that it will be clear to them. And same as here in PGH, more than 50% of the infections come not from the hospital, it comes from the community and from the home. So pareho kami ng observation. And of course, we need the support from the HMOs and the health partners. And digitalization is the key. Here in PGH, we have the radish, the okra, and carrot. These are These are the acronyms for our digitalization of our health records. So that's very important because we minimize the coming of the patients to the hospital. So it can be through telemedicine. We also added, we have leaves for our healthcare workers, which they can access anytime they wish to. Mental health programs are emphasized by Dr. Rosalie Rivera, and she said that now they are going into the hybrid form of their telehealth consultation. From Dr. P.M. Hernandez, the chair of the Department of Environmental and Occupational Health of the College of Public Health, he said, as mentioned by others, institute control measures, and also his concern for the smaller companies and their ability or inability to institute these measures. He said that stakeholders should be engaged, such as the government and private sector, the DOH, the civil service, the communities should all come hand in hand so that we can all combat this pandemic. Lastly, he mentioned the aim of the occupational health is to promote mental health, prevent disease and injury, protect our employees, the risks and hazards, and the placing of the worker in a situation adapted to his training and capabilities. I think that was a well explained webinar, and we hope to see you in our next webinar. Thank you.
Thank you very much. That's Dr. Stella Jose, who's our Deputy Director for the Philippine General Hospital, for that excellent summary. And I'd like to thank all our speakers. I think we had a fantastic webinar today. Really very strong public health focus and something that we all learned from. Okay, so next week, ito, imbitahin nyo na naman yung mga tropa nyo. This is a hot topic. We're going to talk about booster shots and mix and match. Pwede bang i-mix and match? No? So ito ay we're trying to round up the best speakers we can get, but you will hear it first here on your online credible online community. So next Friday, samahan nyo kami, pag-uusapan natin yung booster tsaka yung mix and match. Okay, Raymond, over to you.
Thank you to all of our excellent lineup of speakers po, no? Hindi po talaga matatawaran ang credibility and expertise of each and every one of you. Maraming salamat po for taking the time out in your busy schedule to join us here at the Stop COVID Deaths webinar series. We are also really thankful to the Philippine College of Occupational Medicine for being our co-sponsors for this webinar. It was really very important for us to be able to talk about occupational health and safety, lalo na po na there's a de-escalation of in terms of alert levels, in particular for the National Capital Region or for Metro Manila. We will also like to give this announcement na yung po mga nagtatanong doon po sa kanilang mga napanalunang prizes last week. By next week po, maihahatid na po ito sa mga UP constituent universities, and we'll be able to provide you with more details on how you'd be able, where and when and how you'd be able to claim your prizes po sa inyong naturang UP constituent university. So please stay tuned sa mga announcement pong iyon. That wraps up our webinar for this week. Maraming salamat po. Oh, before we conclude, we'd like to acknowledge the very hardworking team behind the Stop COVID Deaths webinar series. Without each and every one of you, we will not be able to churn out this quality content po each and every week. We'd also like to mention that all 75 episodes of the Stop COVID Deaths webinar series, and then afterwards, including this webinar po, will be archived in our archive po for viewing at the YouTube channel ng TVUP. So if you could type in youtube.com/TVUP TVUPPH, please take note po how it's spelled. You'd be able to watch all of our 76 webinars to date. So maraming salamat po. We'll see you again next week, same time, same channel po. This will be our regular Friday lunch date. We hope that you'll be able to Bring in more and more of your family members, your relatives, and your co-workers to join us next Friday. It's a date.
Together, we can stop COVID deaths.
So keep safe, keep healthy, and see you online.
The enemy remains unseen. I'll keep your hand in mine. Let's say a prayer one more time. I know you long for home, but I am here, you're not alone. I'll stay with you until the coast is clear. The others pain before my fears, the others lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. Just look into my eyes and say his name to realize it's fine to be afraid. Just hold on to the word he gave. This time will come to pass, 'cause this salvation's made to last. He'll carry you to see the break of day. The others pain before my fears, the others vows before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'm here to hold the line. I'll keep my word until my time. The others pain before my fears, the others lives before my tears. But right behind the mask, I look into myself and ask, do I have strength to carry on? My God, how long must this go on? I need you here to keep me strong. I'll keep my word, your word is mine. The others pain before my fears, I'm pushing on despite the tears. Please take us through another day. Just hold my hand, and I will hold the line. I will